It gives me great pleasure. Good morning, everyone. It gives me great pleasure welcoming all of you to this Facebook Live edition on the occasion of World Diabetes Day 2020. I'm Dr. Manoj Chawla, consultant diabetologist at the SL Raheja Fortis Hospital, Mahim, Mumbai. And we are celebrating World Diabetes Day with this year's theme of diabetes and nurses. Now, it's important that we acknowledge and recognize the role that nurses are playing in the lives of people with diabetes. Today, more than 50% of the healthcare workforce is formed by the nurses. And we are all aware that in times of this pandemic, the huge role that nurses and other paramedics have played in joining hands in improving lives and saving lives of many people across the world, especially those with diabetes. When it comes to diabetes, the nurses not only work as nurses, but they also double up as diabetes educators. So we here at Raheja Hospital undertake courses to train our nurses to be diabetes educators, to learn more about the finest aspects of diabetes, including the very interesting new areas and avenues of technology in diabetes care. Our nurses are trained to give the best of healthcare to our patients with diabetes, and we acknowledge and respect the kind of work they have done in this pandemic and wish them all the best and remain in gratitude to our nurses. Now that gets me to the topic of discussion today, which is the use of technology in the field of diabetes. I'm often asked, what really is technology doing in a field like diabetes? Well, in fact, if there is one field of medicine which has evolved and which has benefited by technology, it is metabolics, endocrinology, or essentially diabetes. Almost 100 years back is when the discovery of insulin and the work towards discovery of insulin happened in London, Ontario, Canada, about 100 years back. In fact, the idea to Professor Banting about extracting the pancreatic extract from dogs, which may contain insulin, which may be used to treat people with diabetes, was something that struck him around the 31st of October, that was in 1920, and by 1921 they were able to successfully do the experiment and get the first extract of insulin to be used onto a patient, Leonard Thompson, whose life was saved. So over 100 years we have come a long way in the journey of newer advances, both in monitoring of diabetes as well as in treatment of diabetes. When we talk about monitoring of diabetes, it has evolved from the fact that people realize that the urine of people with diabetes is extremely sweet, and one of the earliest crude methods of figuring out how high somebody's sugars could be was by tasting of urine. So from tasting of urine, we've evolved to the most non-invasive methods of testing of glucose to figure out how much is the sugar in an individual. And of course, in terms of treatment options available for diabetes today, we have evolved from the crude insulin extract to the finest designer insulins that we have available today for our people with diabetes. Insulins that work for 24 hours. Today, work being done for insulins which are going to be working for the entire week. Also, of course, work being on for oral form of insulins and other therapies in diabetes which have evolved and changed the paradigm of how we manage diabetes. A lot of technological advances in the newer and newer medications that are being used today to help patients with diabetes not only manage their blood sugars, but also essentially manage their weight better, their blood pressure, their cholesterol, and eventually lead to a better quality of life with minimal or reduced or no complications, and of course longer life expectancy and a healthier life. So when we talk about some of these technologies that help our patients with diabetes, two things that Two things which come right up to mind is the use of technology in monitoring diabetes and the use of technology in administering insulin. When we talk about administering insulin, it is the use of insulin pumps, which is a means of delivering insulin in a far more accurate manner and something closer to the concept of artificial pancreas. Those individuals who require to take insulin injections more than 3 to 4 times a day, especially our patients with type 1 diabetes, benefit hugely with the use of insulin pumps. And insulin pumps also today, over the last several decades, have evolved to the finest available insulin pumps today in the world, which also have the means of continuous glucose monitoring and automatic insulin delivery based on some preset algorithms and almost functioning like an artificial pancreas. In the field of monitoring, our technology has helped us to move from the testing of urine for glucose, as I said, use of urine strips. In earlier days, we would take urine samples and then take it in the test tube and add the reagent and heat it to see the change of color. From there, we've evolved to the use of glucose meters, finer advances in glucose meters using minimal blood from the blood pricks, getting into the connected meters today. So when I say connected meters, it means that the most available newer technology glucose meters today allow the sharing of data from the glucose meter to the apps on your smartphone. Also at the same time allows connectivity with other family member or a caregiver, and the information can be connected to the software installed in your clinician's and your doctor's office. So there is sharing of data which allows doctor's office also to supervise at times, especially for those patients who require that close supervision to keep a check on their sugars, or family members to check on a young child with diabetes or on an elderly individual who may be staying alone. So that is technology today which has evolved to the use of apps with connected glucose meters. Moving ahead, we've also had the use of continuous glucose monitoring. One of the finest advances today in the field of glucose monitoring has been the use of CGM devices. In fact, today we have the availability of continuous glucose monitoring patches, small sensors which may be installed or just stuck onto the arm by the patients themselves, and this allows them to see the reading on a small scanner just like your smartphone. Just move it across and you are able to see your sugars almost on a continuous basis, and you are able to change the sensor once in 14 days. So continuous wearable sensors which are waterproof, which don't necessarily fall out, it doesn't disrupt your life or your schedule. You are lying down, you are rolling in bed, you are having a shower, nothing comes off usually. So that kind of technology today has helped patients with diabetes live a healthier and a better quality of life, which allows them to take care of their sugars, their health, at the same time not feel depressed or not feel deprived of doing any of the things that any other person without diabetes would be able to do in their daily routine. So technology today is helping us clinicians and helping our patients much more to live a healthier life and to avoid complications and to get to see the complete picture of blood sugars, not be worried about hypoglycemia, not be worried about extreme high sugars, especially in children with type 1 diabetes. The possibility of sugars going very high, landing up with diabetic ketoacidosis, getting hospitalized has been extremely high. But today, with the use of technology, we are able to largely avoid and minimize any of these complications. So technology is helping us evolve and improve our management of diabetes, and we are extremely proud that at SL Raheja Hospital, Fortis, Mahim, Mumbai, we are able to offer the best of these technology to our patients who require this. We have a great team of diabetologists here and some who are extremely pertinent to use of technology, and we are able and happy to offer that. So with this few words, I again thank all of you for joining in for this message with me, Dr. Manoj Chawla, on this Facebook Live. And I see some of you have posted the questions as well. Let me see if I am able to see any of the questions to be able to answer that. So there are specific questions which are pertaining to the cost of insulin pumps and the cost of glucose meters. Well, insulin pumps, as I said, is essentially for patients who are more dependent on insulin or have to take multiple shots of insulin. The cost of insulin pump may vary from anywhere from 1.5 lakh of rupees to about 5 lakh of rupees depending on the model used. This of course comes with some 4 to 5 year warranty, and they have to take some consumables every month. There is of course cost involved, but this is a niche treatment available for those who are going to benefit, and it's always good for all of us to be aware that these kind of treatments are available and to discuss with your doctor whether that particular patient will benefit from insulin pumps. As far as continuous glucose monitoring, a lot of CGM today is the professional CGM, which is done through the hospital or the doctor's clinic, and on average may cost anywhere between 3 to 5,000 rupees for one time reading, which gives us a 14-day complete graph of how the sugars are moving. Again, a wonderful tool. It allows every individual to learn and see how their sugars are behaving, how their particular food or lifestyle affects their sugars. It's a great learning tool, and hence should be used every now and then in consultation again with your clinician to see how it may benefit and help you change your sugars to a better reading or avoid hypoglycemia, or eventually help you go towards a better HbA1c goal. And there are some other question asking whether we have this available at Raheja Hospital. Yes, as I said, we have now the CGM available at Raheja Hospital, and very soon probably a specialized diabetes pump clinic as well. At this hospital, we are happy to offer the best and advances in technology to the patients seeking help here. Any more questions? So with this, let me thank all of you for joining in and taking our message of technology in diabetes and acknowledging the role and thanking the role of nurses in diabetes care and the huge role that they play in general in healthcare. Thank you so much for joining us. Have a wonderful day, and wishing you all a very happy Diwali and happy World Diabetes Day. Bye-bye.